Engaging Women Health Leaders in Afghanistan, a Proof of Concept. I'm Trina Haque, Practice Manager for South Asia in the Health, Nutrition and Population Global Practice of the World Bank, and this is my leadership project. First, the context. Since 2002, Afghanistan has relied largely on NGO service providers contracted by the government and financed by international development partners to deliver healthcare services free of charge to the people. This contracting out service delivery model has led to improvements in most of Afghanistan's health indicators over the last 2 decades. The August 2021 Taliban takeover, however, led to an abrupt stop to most international aid to the country, including for health. While international assistance has resumed since then and health services are being delivered, a major question underlying this global support from the start was how women and girls would fare under the Taliban regime 2.0. With this question in the background, I embarked on my leadership project aiming to help senior women remaining in the Afghan health system to become stronger managers and leaders in their respective domains. The project would use digital platforms and Afghan diaspora women as trainers in a cascaded training of trainers approach, delivering content drawn from the World Bank and other sources translated into local languages. At almost the same time, though, the Taliban started issuing successive edicts increasingly constraining women's opportunities. The requirement of mahram, or the practice of mandatory accompaniment by a husband, father, or brother for any travel or access to services, a ban on secondary schools for girls, a ban on higher education for women, and on December 24, 2022, a ban on women working in all NGOs, local and foreign. These restrictions have impacted access to health services by women, especially in some remote provinces. Moreover, at provincial and district hospitals, female doctors and staff are now required to manage female wards and associated functions separately from their male colleagues. While the relevance of my leadership project increased, the context in which it was to be implemented grew more complicated and potentially riskier for women who participate. As the context evolved, so did the approach of the World Bank. The bank made new financing for health contingent on entry criteria for access and equity being met, including that women and girls are allowed to receive health services, and female health workers are not barred from delivering services to be verified by a third-party monitoring agent. It turns out that the health sector is exempted by the Taliban from the NGO ban on female workers. Hence, our program continues. The bank is also introducing new activities to counter the bans, including training for women health workers via distance learning. The design of my project has also changed. More limited in scope, more open to local customization and beneficiary input, and potentially to be embedded in the World Bank's Core Health Program. This year-long leadership journey has helped change my perspective in 3 ways. First, my project and I are more comfortable with continuous adaptation as a practical way to move forward. Second, building a coalition, while time-intensive, is essential to improve sustainability. Third, our efforts must not inadvertently render the intended beneficiary even more vulnerable. This journey to be a more authentic, inclusive, strategic, impactful, and I would say more resilient leader has better prepared me to engage in Afghanistan and elsewhere. I'm grateful to WomenLift organizers, including coaches and mentors, my World Bank Afghanistan colleagues and team, and my fellow 2022 cohort members for accompanying me on this leadership journey, a journey which is not over yet. Thank you.